This morning, the revolution in weight loss drugs may soon be turbocharged by a new, more convenient option to the injections.
Can we please talk about GLP-1 shot anxiety?
Eli Lilly says a first-of-its-kind pill could be on pharmacy shelves by next year after a successful phase 3 clinical trial.
This is exciting, and it really starts the clock here for us to move forward towards FDA approval.
In the trial targeting overweight adults, those given the highest dose lost up to 27 pounds over 72 weeks. Not quite as much weight as those who take the injectable versions, but still significant. And weight loss wasn't the only benefit.
We saw improvements in the bad kind of cholesterol and triglycerides. We saw decreases in blood pressure.
If approved, the pill will be the latest version of a GLP-1 weight loss and diabetes drug, joining injectables like Zepbound and Ozempic. The relatively new class of drugs has transformed people's lives with dramatic weight loss.
The very first time I took a GLP-1,
including celebrities like Oprah, Charles Barkley, and Rosie O'Donnell, who have shared their experiences publicly. Right now, the U.S. is the biggest market for the drugs, projected to be worth $80 billion in the next 10 years, in part because a pill could soon be on the market.
But a lot of people do not want to take injectable medications, and so having an oral option just increases our ability to treat this disease.
Banking on FDA approval that the company does not yet have, Eli Lilly says it has already started manufacturing and stockpiling the pills.
Does this mean because you don't have an injector that you aren't going to run into the same supply problems?
That's exactly right. It doesn't require refrigeration. It doesn't require sterile filling of syringes.
Weight loss doctors caution that having enough supply is only part of the solution for their patients. Maintaining a healthy lifestyle is also still important.
Pair it not just with a healthy eating, but also exercise, specifically resistance training. We want to be healthy. That's really what it's all about.
We should mention Eli Lilly says there are side effects similar to the kinds of gastrointestinal problems people may experience with its injectable drugs, Mounjaro and Zepbound. Guys, back to you.
All right, Steph, thanks. Let's turn to NBC News medical contributor Dr. Natalie Azar. A lot of people have been waiting for this pill option. Would it have the same effectiveness?
So, you know, if you look kind of comparing the weight loss on average up to 12% of your body weight, as opposed to numbers that we see with, let's say, Wegovy or Zepbound, where that percentage of body weight loss could sometimes even be more than 20%. So, you know, a little interesting reaction this morning. I'm reading online. Experts have classified it as a little bit lackluster. But I think that's not telling really the whole story, because I think the big message here is that this is a pill, right? I mean, as Steph said in her piece, a lot of people don't love the idea of taking an injectable. There's only one other oral GLP-1 on the market right now, and it's for type 2 diabetes. And the weight loss there was significantly less than this one. So I think this still is going to have a significant role and a tool in the toolbox.
So these injectables have been revolutionary for so many people. They've also been very expensive.
Yes.
Is the cost different for the pill?
So we don't know yet, Willie. And, you know, I think it's intuitive that making an injectable versus a pill, we're talking about storage and manufacturing and transport, is all going to be less expensive with a tablet. However, I have seen in our own world in rheumatology where we have oral medications that are exactly the same price as injectables. And the issue is that with this pill, it's the only one in the market. They have no competition. So they said that they're going to set the price once the FDA gives them approval, and I think they probably will. So that, I think, is to be determined.
So if the pill widens for potentially the population of people who are willing to take these drugs, is that a good idea? I mean, who is it for?
Yeah, so it is still right now for people who are either obese or are overweight, who have one other weight-related comorbidity or condition. So again, it's not going to be for people who need to lose that 10 or 15 pounds. And I think another thing to highlight, to also give credit where credit is due, is that not only did people lose weight, it was well tolerated, but some of those cardiovascular things that we look at, lowering your LDL, lowering triglycerides, lowering blood pressure, and they even found that it cut levels of inflammation in the blood almost by 50%. Those are all really good things. I think where we're going to see this possibly have a place is, let's say that you start off treatment with an injectable. You achieve the weight loss that you wanted to achieve, and then maybe you transition to a pill, to maintain that weight loss. These are all things that, you know, that certainly Lilly is thinking about. And I think that people who prescribe for patients are going to see where it's going to fit into the arsenal. But I absolutely think it's going to have a place, and a good one.
All right. Natalie, thank you very much.
Thanks, Natalie. Still.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.